what is the oath we took? The first part of the oath is we shall do no harm. A tooth that is salvageable shall never be extracted. So by default and by the oath we take, and by biology and by science, first aspect is to save the tooth or the root that we can.
Okay. Then?
So endo becomes the treatment of choice by default. No implant, man-made material can parallel or come even close to what God made. A root must be saved. If you have totally unfavorable crown root ratio, if you have unsalvageable root because of either the fracture in it, vertical fracture, or you have untreatable periodontal infection, or you have
Frication involvement?
not necessarily, perforation, or you have internal or external resorption, you must salvage the tooth. If you have a periapical cyst, no problem. We can do periapical endodontic treatment by perforating the apex and inducing bleeding at the apex. That would help blood come in and take away the periapical granuloma. And nonetheless, you go ahead and you do the root canal treatment, fill the whole canal system all the way, sealing the apex particularly, and waiting for the periapical radiolucency to resolve and infection to resolve, just in case, like 1 in 1,000 options, that the apex does not resolve itself. You can always go back and do an apical curettage and possibly even bone grafting with really cheap material like calcium sulfate that would fill up the cavity with bone within a matter of about a month or so. That has been histologically proven, and you can check it on the net. Endodontics is number one. If in case endodontics fails, that is when I would take it out and definitely recommend the patient to get an implant instead of a fixed prosthesis, because in case of a fixed prosthesis, you're always cutting away two adjacent teeth. Some people would come up with an argument that you go ahead and if the adjacent teeth need new crowns done or they have old crowns that need to be replaced, then you can still do a fixed partial denture. I would still disagree with that. That no matter when you do a fixed partial denture, it is always inconvenient and very hard and almost practically impossible for a patient to keep it perfectly clean like you would do other teeth. So fixed partial denture, in my opinion, today should not be one of the choices at all. Yes, it is an option, just like doing no treatment in a severe infection or not having a replacement. To me, not having a replacement, there is a better option than a fixed partial denture because patient gets the false sense of security of having teeth when in the meantime they're losing the alveolar bone and the quality and quantity of alveolar bone both decrease. I would rather give them a removable partial denture and remind them this is a temporary measure and they should eventually or sooner or later get a fixed implant there instead of a fixed partial denture.
So, according to you, the removable option is better than the fixed
Right.
partial denture?
Yes. Because you're cutting two teeth on the side. And even if the two teeth on the side need crowns, I would do individual crowns so they are periodontally cleanable. And remember, periodontics is what rules everything that we do. If the base is off, everything is going to fail.
And then why would you do implants?
Implant I would do as a replacement, as a second option.
After endodontics?
If the endodontics fail, or if the tooth has fracture right down the middle, or if it has external resorption or internal resorption.
Yeah, I got
or
that.
unrepairable perforation. If you have a perforation, you can still repair it with MTA. In this day and age, there should be a heavy burden placed on doing endodontic repair than even doing an implant. But if endodontics fails, then you go ahead and you do an implant. An implant should be single rooted. Or you have completely removable system, like in case of full denture. I would still go with a case in which you should be able to remove the dentures, have it snap fit, so they can clean it underneath. Because no matter what kind of treatment you do, if the plaque accumulates, it's going to lead to decay or destruction of the periodontal ligament.